The World Health Organization (WHO) has declared monkeypox or Mpox outbreak a public health emergency of international concern under the International Health Regulations of 2005.
Last week, I announced that I was convening an emergency committee under the International Health Regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
The outbreak erupted from the Democratic Republic of the Congo (DRC) in Africa, where around 537 deaths have been reported so far since the start of 2024. According to WHO, there is an increased risk that Mpox can spread to other parts of the world. Around 34 countries in Africa have reported cases of Mpox. A press release by the Director General of the African Center for Disease Control and Prevention (CDC) stated that thousands of people in Africa have contacted the virus so far. Mpox is an infectious disease caused by a virus. Symptoms include fever, chills, sore muscles, and fatigue, followed by blisters or rashes on the skin that change into scabs over time. Mpox typically occurs in rodents like mice and non-human primates like monkeys, but can affect humans as well. Mpox is highly contagious and spreads through contact. There are two different types of the virus, Clade I and Clade II. Although both types are considered serious, Clade I is associated with higher mortality rates. The current virus is a novel offshoot of Clade I, named Clade Ib, that has been detected in DRC, Uganda, Rwanda, and Kenya. As of July 2024, some 37,583 cases and 1,451 deaths have been reported from 15 African Union member states due to the virus, which primarily spreads through sexual contact. According to WHO, it is not confirmed if Clade Ib is more transmissible than other variants, but evidence indicates that it transmits more efficiently than previous types of Mpox. Countries in West and Central Africa are considered endemic to Mpox, which was first detected in humans in 1970 in DRC. In 2022, an outbreak of Clade II led to around 95,000 cases in non-endemic countries like the US and several European nations. But as compared to Africa, the 2024 virus's spread to the US remains slow. A survey of untreated wastewater in multiple states by the Center for Disease Control and Prevention detected positive samples for Mpox DNA in only 3 sites in the US. There are currently 2 WHO-approved vaccines, Bavarian Nordics Geonos and LC16, made by KM Biologics that are mandated to treat and prevent Mpox. But none of these vaccines have reached Africa so far. According to the European Commission, its Health Emergency Preparedness and Response Authority (HERA) will procure and donate 75,420 doses of the MVA-BN vaccine as an immediate response to the Mpox outbreak in Africa. CDC and WHO have appealed to countries across the globe to express solidarity to Africa and assist in the form of medical aid. The United States Department of Health and Human Services has claimed that the US has provided $17 million to support Clade I Mpox preparedness in Eastern and Central Africa. Africa CDC has also been granted $10.4 million in emergency funding by the African Union. The African CDC Director General Jean Kessia has called on media personnel and international community to direct the world's attention towards the crisis in Africa to prevent another COVID-19-like situation.
You can also help to mobilize the international community to know that something is happening in Africa. And if they don't come to work with us together, they can also be affected. And we don't want to see again the world being affected as it was the case during COVID. This is why we need to take proactive action now.